第一点呢，你就给你说过，
Hello, ladies and gentlemen. It's very happy to be here to introduce OO Dental's product, OI self-ligating bracket. Inspired from clinical, with more than 5 years development, OI bracket is made of German medical steel with metal injection molding for one-piece construction. It brings a new level of staff joy and patient comfort to clinical practice. With OEYES bracket, you can enjoy the ease of self-ligation with the advantage of conventional brackets. Now I will have a detailed introduction about OEYES bracket. The first feature is about its material. This material, we use 17-4 medical, as mentioned before, German medical steel as the main material. This material has good property of resistance. This German medical steel has good material, has a good hardness, which can resist high temperature and strong corrosion. So we use it as our main material to produce this bracket. Here is a simple way to test the material property. You can use any pointed instrument, try to scratch the bracket surface, and you will find that there's no scratch on the surface, which can prove that OEYES bracket is made of good material with high hardness. The second feature is about its ultra smooth surface. You can try to touch the OEYES bracket and feel the surface is really sparkling and shining, just feel like a mirror. OO Dental use leading polishing technique to polish the surface, creating a mirror-like smooth surface, offering enhanced patient comfort. And it also dressed in a more rounded contour. The smooth surface can lead less irritation to the soft tissue, minimize food and plaque retention, offering better hygiene, as well as stress while chewing. So therefore, it can reduce the bonding rate. The third feature is about its lower profile. In general, some self-ligating brackets height is 2.82 millimeters. Compared to them, OEYES brackets average height is 2.15 millimeters, reducing evenly 17%. With a lower profile, patient can feel less uncomfortable, and it reduces the distance between the slot and the wire, which makes the wire closer to the resistance center of teeth, bring easier building inspection and precise control. Therefore, it makes less impact from external pressure to achieve lower debonding rate. Next feature is about its individual width. As we know, different teeth have different shapes and widths. So we will decide the mesodistal width of each bracket to fit individual teeth based on their physical characters and biomechanics, offering better expression, rotation, tip, and torque. For example, you can see the width of the bracket for upper central incisor is 3.2 millimeters, the biggest one, while other self-lightening brackets is 2.8 millimeters. So it can lessen contact pressure and contact angle between the wire and the slot, which is beneficial to the expression of tip and rotation. Thus, it can shorten the treatment time and contributes to the bracket slide. And it also contributes to less root absorption. Next feature is easy to ligate. When the doctor tried to use the ligature wire or elastic band on the self-ligating brackets, especially in the finishing stage, they find it difficult to ligate. To allow for easier elastic band and ligature wire uses, we make an improvement for it. You can see the under tie wing area is enlarged. The maximum length of tie wing is 1.08 millimeters, and the underwing height for ligation is 1.63 millimeters. You can see their longer tie wing and enlarged ligation space. So this design offers enough space for ligation. Furthermore, the elastic band and ligature wire can be used at the same time, and meanwhile, the dentist can just use one hand to ligate for convenient and time-saving operation. Thus, it's really convenient to ligate on the OEYES bracket. Next, it's really easy to open. In general, it needs special opening instrument to open self-ligating brackets. So the doctor may cost extra money or time on it. But for OEYES bracket, we don't need any special instrument. We design a special opening hole to fit different explorer. So just use a dental probe, then you can open the bracket. Here is a small video to show you how to open and close according to this easy to open design.
Here is a video showing how to open and close OEYES bracket without any special instrument. On the table, you can see here is an OEYES bracket, which adapts easy to open design. So let's see how we use it now. Take a dental probe and then place it on this opening hole, and then slide down the probe at 60 to 70 degrees from gingival to occlusal. Then the bracket is open. You can hear a click sound, really clear. In this way, the bracket is really easy to open and will not scratch the gingival mucosa. So if you want to close it, just by a little pressure by your finger, then the bracket is closed. No need for any special instrument.
So this video shows us how to open and close with the help of this advanced opening design. This opening design can simplify the clinical operation and prevent scratching to patient's mouth. Thus, it will save doctor's time. Next is about its reliable and safe self-ligating mechanism. This is the key point of the self-ligating brackets, because the doctors may find it difficult to open or close the bracket clip for the retention of food and plate or the design of self-lighting bracket itself, especially when they try to open or close during the treatment. Even the clip will fail to open or will fall off from the bracket. So our R&D team has developed an innovative spring component for more than 5 years. With the help of this spring component, the bracket can be opened and closed easily. Even if it is open and closed for hundreds of thousands of times, the clip still works. We also do a tensile test for the clip using a material testing machine. The result shows that the largest tolerance for the clip is 68 Newton force. So it means that you should be applied at least 68 Newton's force to remove the clip. So the doctor don't need to worry about the fall off of the bracket clip. Next feature is about its easy to detach base. You can see there's a 4 wedges which can help the brackets debonding from the teeth. This will save doctor's operation on the debonding. Also, we have a sandblasting technique on the bracket base, so the bonding strength is enhanced. And we also do a bonding strength test on this bracket. And the result shows that the largest tolerance for bonding strength of this base is 48 Newton's force. Next is about its welding. You can see compared to other brackets, our welding spot is even and clear. But when you see others, they're not clear. Even from this side, you can see even and clear. For the welding strength test, we also do that. And the result shows that the welded part of bracket shows no sign of separating when the tensile reaches 74.47 Newton's force. So the doctor don't need to worry about the separation of the bracket. This is the dental machine, the dental text machine we use. We have standing one and the horizontal one. At present, there are many doctors want to buy this machine to do the test on their bracket, not even brackets. So besides the bracket itself, we also made innovative change on the bracket storing box. We call it micro storing technique. Next, I will show you a video about what is this micro storing technique.
The moment you open the bracket box, do you always find that the brackets have been displaced or lost their direction? Still annoyed by the brackets flying off your handle? Tired of altering the bracket's direction that might result in pollution of bracket base? Worry about the mess and unexpected impact during operation that makes the brackets scatter?
the silicone substance on the bracket box. Number 2, we're also applying an innovative fixing design to fit each bracket so that you as a clinician will never worry that brackets come out of the fixing groove while facing great impact. Number 3, the fixing groove is based on universal curvature setting for different tweezers to clamp easily. Fixing groove has a built-in angulation of its bottom at 15 to 30 degrees to keep brackets tilted for observation and pickup. Number 4, with OO Dental's packaging, no more adjustment before placing the bracket on tooth. We've invested a lot of time and energy to make each bracket right in their mesiodistal direction. This means that you will save a great time for your clinical practice. All you need to do is to enjoy your great time on bonding. There is a layer of special silicone substance around inside the cover plate. Peel off the protective film on it. The silicone substance will allow you to attach to most of the surfaces without any adhesive, like stainless steel, glass, wood, and textile. After trial and error, the hinge of the box is in fair tightness. You can open at a certain angle for your knee, as it's stable enough to bear the pressure while gripping the bracket. Unlike regular bracket packaging, the unique fixing design of our bracket box enables the brackets to stay firmly in their position when facing exterior impact and prevents them spreading out and getting lost. When the bracket box is placed on the sterile drape onto the patient's chest, the fixing groove can hold the brackets in place even if patient moves. This is micro-storing technology. Another feature is its ingenious curvature setting for bracket. It works with any type of tweezers. The clinician can slide the tweezers along the curvature with no effort and clamp the bracket accurately. The brackets are settled at 15 to 30 degrees angulation for the convenience of OO Dental's micro-storing.
So after this, watching this video about our innovative bracket styling box, how do you feel about it? I think I can make a summary for you. When you see the box first, you can see the opening is the automatic opening. This is how the storing box like. First, we have innovative fixing groove, which can keep the bracket will not come out of the grooves when facing great impacts. Then with a universal silicone substance, you can try to attach the bracket to the textile surface, stainless steel surface, wooden surface, or glass surface without any adhesive, which can help you to convenient for any clinical operation and seal for any operation environment. Then about is optional configuration. The lid can be revolved 360 degrees, which can also help you to fit it with different operation environment. Thus, it can offer you safety during the bonding. This is a case presentation of OEYES bracket. You can see the initial condition about this patient. The dental arch is really crowded. Then after 2 months of using OEYES bracket, you can see the dental arch is basically leveling and aligned. It's really fast. Here you can compare the initial condition and the condition after 2 months. It's a big change. You can see initial and after 2 months. You can see how the OEYES present. So this is why we say for OEYES, you can enjoy the ease of self-ligation with the advantage of conventional bracket. With OEYES bracket, you can enjoy the safety and stability, and it will accompany the patient throughout each phase of treatment. OEYES bracket and the bracket box is wholly developed and produced by OO Dental, inspired from clinical pursuit for perfection. So we, OO Dental will continue our innovative development and produce products to make patients feel more comfortable, to save doctors' time and simplify clinical operations. So that's all about the introduction of OEYES brackets. If you have any questions, you can contact your sales representative. Thank you.